Hi, I'm Dr. Rob DeBease, and today I'm going to demonstrate to you the SCAT technique. SCAT stands for Sinus, Cold, and Allergy Technique, hence the name SCAT. It is a technique that is designed to help support the stimulation of the immune system so a person can much more quickly overcome sinuses, colds, and allergies. So, it's broken down into several different steps. I'm going to show that to you today so you understand how it goes. This is Chuck Landrum here. The first thing that we're going to do is stimulate the lymphatic system. The lymphatic system is composed of little lymph glands. So up here in Chuck's head and in Chuck's face, there's all different glands that line under his chin, that go into the sinuses, that go around the ears and in the back of the head. So he's got sinus pressure here under the right side. So the first thing we're going to do is we're going to stimulate what's called the thoracic duct. So we're going to put our hands right here, and it's just a gentle pumping like this, and it stimulates that thoracic duct. For females, we move our hands up so it's not invasive. We don't have to touch the breast tissue or anything like that. We pump the duct, then we come back here and we gently stimulate the lymph nodes that are behind the skull and the lymph nodes in front of the ear and behind the ear, and then the lymph nodes all in the face, under the chin, and we do this on both sides. Good. So this here is all stimulated. The lymph has been pushed down towards the liver. We're now going to go ahead and move it a little bit more towards the liver by pushing on this duct. So this is getting everything drained towards Chuck's liver. Now the next thing that we're going to do is we're going to use a kinesiology, a muscle testing technique, to actually check his sinuses to determine what is stressing those sinuses. Like, is it a food that's stressing them? Is it a virus? Is it a bacteria? Where is it? So in the kinesiology technique, some of you have experienced this. It's using the strength of a muscle to determine a weakness in the body. So Chuck, resist for me. Good. And we're going to check here through his sinuses. So he has weakness here on this side of the sinuses. Resist for me. The left side's good. Good. So he has weakness up here on this part of the sinuses. And we're checking the glands. There's weakness here in these glands. Okay. So most of Chuck's weakness is on the right-hand side of the face. So now what we're going to do is find out what's stressing it. And the way we're going to do that is we're going to utilize these vials here. So this first set of vials has things like bacteria, viruses, parasites, and funguses. And we're going to use these to determine what might be stressing Chuck's sinuses. Nola, can you come here and give me a hand, please? Okay, so it's not a virus or a bacteria. Other side. It's not a parasite or a fungus, really. Let's see if it's a chemical. No, it's not a chemical. Good. Let's see if it's a metal. And in Chuck's case, it's a metal. So there's some type of a toxic metal that Chuck might be holding on to. Okay, so in Chuck's case, it's a metal. We're going to find out what metal it is. Chuck tested positive for lead. Chuck likes to go ahead and make lead bullets. So he tests positive for lead. This is actually the remedy for the lead. This is a special homeopathic preparation, and the way we use this is he can drink this if he wanted to, and that would help him get rid of the lead, but that has to go through his whole body, and that washes out kind of instantly. What we want to do is focus right on that sinus area. So what we're going to do is we're going to use a cold laser. So this here is a cold laser, looks like a pen, and what I'm going to do is I'm going to go ahead and hold this lead to his sinuses. And we're going to take the cold laser and we're going to stimulate the sinuses with the cold laser and the lead. So we're using the cold laser. The cold laser is passing through the lead solution, or the anti-lead solution, I should say. And it helps to stimulate the removal of that lead from the sinuses. Resist. Okay, resist. All right, so we have a little weakness here. Now, if we get him a support liver in there, let's check here. Good, resist. Nope. Let's get that out. See the liver plex. Good, resist. Very good. And so he's going to do a Livaplex. Now, why am I giving him something for the liver? It's because all that lymph has to leave his head. It goes through the lymphatic system, right? It gets into the liver, and the liver has to clear it. So we need to support his liver. So he's going to leave here with a nutritional supplement, a Livaplex, and then we're going to give him something to help his body pull out the metals from his head. Chuck, when he was younger, was a metalhead. Now I really believe him. I know what's going on. Good. So now Chuck tests positive here for Livaplex and for Cleanse. So Cleanse is an herbal formula that's known as a toxic chelator support product. It helps his body to naturally pull metals out of the tissue. So we're going to give him some Cleanse, and we're going to give him some Livaplex. Normally all a person needs is 1 or 2 treatments, and they seem to be much better. So that's the technique. That's the SCAT technique, sinus, cold, and allergy technique. That's it. Thanks.